Okay, so I want to talk about the acetabulum or the hip anatomy. So let's try to start with some photos, and I must say that those photos, the ace- the source should get the credit. So we're starting with looking in the very superficial way on the pelvic bone. We have here the sacrum, the coccyx, and what we are more interested about is this area and especially the area of the acetabulum. So we start from the outside. We said about the sacrum, the coccyx. Here, the acetabulum, this socket that the femoral head will get attached to, is built from. It's working. Yes, it's working. It's built from three bones that come together as you grow up. So we have here superiorly, we have the ilium, anteriorly we have the pubis, and posteriorly we have the ischium. Those three bones collectively, and when they get together, construct the acetabulum. Now, when we have the acetabulum, the femoral head can get into this socket. Now, when we're talking about the femoral head, the hip or this area, which includes the acetabulum and the femoral head, is built from a cartilage, a labrum, that is around 27, uh, 270 degrees around the femoral head, but there is an area without cartilage, or at least articular cartilage, without labrum. This area is in the anterior part of the femoral head, and this area is closed by a ligament called the transverse ligament. Let's show you the transverse ligament. From the transverse ligament, it's important because from the transverse ligament of the femoral head, let's call it, there is a ligament that comes. This is the transverse ligament. From this ligament, there is the ligamentum teres that comes to the pulvinar of the femoral head, which is the central part of the femoral head. If I will be able to find an image that show you, here it is, that there is an articular cartilage, the labrum, around the femoral head 270 degrees, but in the central part, we have a ligament, the transverse ligament, that from here, the ligamentum teres goes out into the pulvinar of the femoral head. Now, if I'll get a very good image, I'll be able to show it to you better than I can. I do it now. You can see here the transverse ligament from here. From this ligament, the fibers of the transverse ligament comes the ligamentum teres. This connects to the femoral head inside him to the pulvinar, which is the central part of the femoral head. So the idea is not all the femoral head is covered by cartilage, some of it by the transverse ligament. Now, when we go further and look again on the acetabulum, if I found it, where it goes. So let's look again on the pelvic bone. So let's look, or not, that acetabulum was a good image. So let's look again on that acetabulum. Now, when we are looking at acetabulum, we have important landmarks. Let's start. We have the anterior superior iliac spine, which is the origin of the sartorius muscle. Now, remember, no, this is not a very good image because it doesn't tell you where is the anterior superior iliac spine. Okay, so I will tell you. I think there are many, maybe another more anatomical picture will be better. Not a great image. Okay, we have here the anterior superior iliac spine and the anterior inferior iliac spine. Just I want to see that we are walking. Okay, this is a better one. Anterior superior spine, anterior inferior spine. Those are important landmarks because from this area there is the origin of the sartorius muscle. You remember the sartorius goes like this in a very fashioned way and goes to the other way around to the medial side. The sartorius muscle, if I show you this, it gets until the tibia. You can see here the sartorius from the anterior superior spine goes around the muscles and lands on the tibia. I think it's in the, I forgot the name. I forgot the name. There are three tendons that come together here, and it calls the, I forgot. I don't know why I forgot this name of the area. Never mind. Let's continue with this. Okay, so the anterior superior iliac spine, origin of the sartorius muscle. Now we're talking about the anterior inferior iliac spine, the origin of the rectus femoris muscle. Rectus femoris go right over here to the patella. Rectus femoris go to the patella. Rectus femoris, you can see it right over here. It goes to the patella, which is this bone, which is a sesamoid bone, and rectus femoris tendon, suprapatellar tendon connects to it, important for extensor mechanism. So anterior superior spine, anterior inferior spine. Remember that this is the iliac bone, this is the pubis in the anterior part, this is the pubis, and this is the ischium. Now let's talk about other landmarks. We have here the femoral head, and we have the femoral neck, femoral head, femoral neck. Look right over here. It looks as if there is a hole in the femoral head, but remember, this is the area in which the ligamentum teres goes from the transverse ligament and gets into the pulvinar of the femoral head. So this is not a pathological fracture. This is not an I don't know what. This is okay. This is normal. So don't mistake for it for I don't know fracture, avulsion fracture, whatever you think. This is not. This is the area from which the ligamentum teres goes inside the femoral head and connects to the pulvinar. So we continue. We have the femoral head, then we go to the femoral neck, and then we go here to the trochanters. Very important area because there are fracture over here, intertrochanteric fracture and things like this. Important, very important for orthopedics. So we are talking here about the greater trochanter, which is right over here. You can see it right over here. This is the insertion of the gluteus medius and gluteus minimus. Remember that the gluteus muscles are from the posterior side, from the bottom. So gluteus muscles are like from the posterior side, from the bottom neck. Here you can see the gluteus. You have the gluteus medius, the gluteus maximus, and the gluteus medius is the smaller one. So the gluteus medius and gluteus minimus muscles connect or insert in the greater trochanter. Now we have the basicervical region. It's just the base of the neck of the femur. We have a line that connects between the greater trochanter and the lesser trochanter, and it's called the intertrochanteric crest. So you can understand, if this is the greater trochanter, intertrochanteric crest, we get to the lesser trochanter. Very important thing about the lesser trochanter is that this is the insertion for the iliopsoas muscle. Remember that iliopsoas muscle is combination of the iliac, ilium muscle and the psoas muscle. Iliopsoas muscle. if I said it correctly. You can see two muscles that come together. This is the iliacus muscle and this is the psoas muscle. The psoas muscle comes from the lumbar spine and the iliacus from iliac bone, and then come together and insert in the inferior, in the lesser trochanter of the femur. Now, look at this muscle, very massive muscle. This is one reason this massive muscle should protect the lesser trochanter from fracture. Therefore, when you see lesser trochanteric fracture, namely a fracture of the lesser trochanter, think about a pathological fracture, namely think about metastasis, think about a tumor, because the lesser trochanter should not be fractured because it has very intense mechanism of defense. So if you see a fracture of the lesser trochanter of the femur, think about a pathological fracture and look for psoriasis, osteoporosis, Paget disease, metastatic tumor disease, primary tumor disease, I don't know what, insufficient fracture, something that is pathological, please. Okay? Important note to understand it. Just for you to note, this is not a normal rectum. Or I don't know what it is, vesicle, rectum, bladder. I mean, I'm not sure where they put inside the contrast material, but this is not normal, this area. I'm talking just about the bones right now. Okay, so greater trochanter, gluteus, minimus, and medius. Lesser trochanter, iliopsoas. Intertrochanteric crest, femoral head, with its very important part, the fovea capitis. In this area, the ligamentum teres comes in. We have the femoral diaphysis. Now, if we look at the bone, again, that build the acetabulum, which acetabulum is the socket in which the femoral head gets inside to connect to the pelvic bone. This is the acetabulum. We see the iliac the iliac bone, iliac crest is this area. We have the superior pubic ramus, which is right over here, superior pubic ramus. We have the obturator foramen, which is this hole right over here. We have the obturator internus and externus and everything, the muscles. I'm not going to talk about it now. This area is the inferior pubic ramus, iliac bone, pubic bone, so pubic, inferior pubic ramus, and ischium, so superior pubic ramus and inferior pubic ramus. Now, I just did a very big mistake. Okay. And here you have the ischial tuberosity, which is the origin of the hamstrings. Now remember, when we're talking about the hamstring, we are talking about semimembranosus, temimembranosus, biceps femoris, which with its heads. So the hamstrings, a very collective name from those muscles, semimembranosus, semitendinosus, and biceps femoris. I think I'm not mistaken. All of them are considered hamstring muscles. All of them are part of the hamstring muscles. Why I say G, I'm not sure. Biceps, semitendinosus, semimembranosus, right? So no mistake right over here. And now let's continue to the lines. We have here some lines. This is not a great picture to show you the lines. So maybe I try to find another picture. This is way better. Oh, something is not right here. Okay, never mind. Ignore this part. Let's see the healthy part without the dislocation. Or so let's look on the lines. This line you can see right over here. It's called the iliotibial iliac bone, pubis bone, iliopectineal line. This line connects from the iliac bone to the ischium. You can call it ilioischial line, ilioischial line, iliopubic bone, iliac bone, iliopectineal line, iliac bone, pubis bone, pubic bone, iliac bone, ischium, ilioischial line. Okay, so those two lines are important. And what else can I tell you? Let's try to look a little bit on the muscles that surrounds the hip. Now, when I'm talking about the hip, I'm talking about the acetabulum and the hip anatomy. I'm talking about the acetabulum. This is the hip joint. I'm talking about the area right over here. So if I'm talking about the definition of hip anatomy definition, you can see that we talk about the bones that are the femur, the ischium, the pubis, and the acetabulum. So all this area includes the femur and the acetabulum. We're talking about the hip joint or the hip area. Okay. Of course, all the muscles and ligaments. So let's try to look on the muscles and ligaments. And here, this is musculoskeletal MRI. I don't know from where it is, but it shows you the muscles and it shows you the names. So it's quite nice. So let's look right over here. You can, of course, see where we are right over here. So I can look at the height I want like this. You can see here the femoral head. You can see here the ligamentum teres from the transverse ligament goes inside the pulvinar. You can see more inferiorly the femoral bone, the neck of the femur, and whatever we want, we can see right over here. So when we are talking about the muscles, you can see here the iliacus muscle, the sartorius muscle. You can see the gluteus medius, the tensor fasciolata that goes laterally. You can, of course, see the gluteus maximus, which is much bigger muscle. You can see the gemellus superior muscle, which connects the pelvic bone to the femur. I'm not going to talk about it too much, just for you to see the main muscles, gluteus maximus. What else is important for me? Iliacus muscle, which connects to the psoas muscle to form the iliopsoas muscle right over here, which connects, you remember, to the lesser trochanter of the femur, and there a fracture in the lesser trochanter should be considered pathological fracture until proven otherwise. Rectus femoris muscle, which goes to the patella, very strong muscle. You can see how big it becomes. You have the gluteus medius, gluteus minimus, and gluteus maximus. Those are the gluteus muscles. You can see the tensor fasciolata, which goes right over here and goes to the lateral side of the thigh. Of course, the femur, the head of the femur. And this is the acetabulum, the anterior acetabulum, and the posterior part of the acetabulum. Acetabular fossa right over here. The labrum that surrounds most of the femoral head. We said that there is a part with transverse ligament without labrum, so remember that this is important. Symphysis pubis, this is the area that should connect the two in the anterior part of the pelvic bones. Pectineus muscle, psoas muscle. Psoas comes with the iliacus muscle, they form the iliopsoas muscle, as we said. And there are, of course, some nerve, like the sciatic nerve, important nerve right over here, can cause sciatica. It comes, of course, from the lumbar spine and the sacral spine, connect some nerve roots and creates the sciatic nerve. Okay, we have the adductor, obturator, obturator internus, obturator externus, which connects to the obturator foramen, as you saw, surrounds him. Adductor magnus adducts the thigh. I think you saw the main muscles and the main area on this axial view, on this axial slice, and this is quite enough. Thanks very much for the musculoskeletal MRI, and this is enough. So we talked a little bit about the hip anatomy, and I wish it is quite enough for you. This is, of course, the ilium. Okay, this is enough. Thank you very much. If there are any mistakes or corrections, please tell me. And this is it. Thank you very much. This is a little bit about the hip anatomy.